are three areas I'd like to cover around what we call the AGPs, the donning and doffing procedure, and breaches, so what happens if something goes wrong with the PPE. So first, AGPs. So from a trust point of view, we see this as basically being suction and intubation. This is when we're going to use the FFP3, and I'd like to take some time looking at the FFP3 and how we put it on. FFP3 mask, filtration face piece. You'll find a metal strip across the top. What I'd like to do is encourage you to shape that to your nose before you actually put the mask on. So if you've got a rounded nose, use a curve into the top, emphasizing where the nostrils are, or if you've got a sharp bridge to the nose, make it a sharp point. Place that on and shape. When we actually don the mask, what we're going to do is keep the elastics and prepare the elastics for when we come to take it off. First thing to do, sharp exhale, so breathe out, use your eyelashes, that'll tell you if you've got a leak at the top. Yeah? Secondly, make sure that the cup is completely under the chin. Yeah? When it comes to the actual elastics, we're going to position those in such a way that when we come to take the mask off, first of all it's held on securely, but it can be removed easily. Okay? So let's look at that removal. When I come to removal of the FFP3, I want to lean forward, I want to close my eyes, I want to stop breathing. I don't want to touch the gross leaking at the front of the mask where it's most contaminated. I'm actually going to use from the back and take the elastics up and over. Slow and deliberate, away from the face, then eyes open, start breathing. Okay, in addition with the FFP3, there's something I'd like to consider. At the moment, I've got a beard that allows the mask to be worn around, so all of the areas where it comes into contact is actually clean shaven. If you're not getting a good fit, it's time to consider actually being clean shaven to wear the mask. Okay, the next area I'd like to talk about are aprons. So, deliberately doing this outside so you get the feel for wind and how the apron may actually respond. So let's look at a number of things. If our apron is on and we're concerned about gross contamination, when the patient goes outside and that apron potentially riding up, we can use a second apron. Act as a cover, remove the first, extricate the patient, and then remove the second. When it comes to taking the aprons off, there's a number of things I want you to consider. Where down the front of the apron we've got the most contamination, that's the area we're going to try and protect. So what I'm going to do is a very slow and deliberate removal. So again, I'm going to break at the back, fold the apron down at the front, then break at the sides, and then very slow and deliberate away from me and away from colleagues and away from the patient. I'm going to take that apron, roll up so that the contaminated side is kept to the inside, and then dispose. The third area I'd like to talk about on doffing is gloves. One of the points with a lot of these procedures, you need to practice. If you haven't had the opportunity, take some time out. It's just like any other skill that we have, it needs practice. So just a few reminders on glove removal. Again, our hands, where we're coming into contact with surfaces, the patient, etc., areas of most contamination. So when we come to remove, I'm going to fold the glove over so that I'm exposing the clean side, and then clean side in, again not allowing the glove to flick, using the clean sides, and then into disposal. Okay, So that's the second area, donning and doffing. Things can go wrong. It may be that a piece of equipment fails. It may be that a member of the family or something like that happens to cough nearby. Yeah, you need to be able to counter that in some way. There's some things to consider, okay? Think about what your exposure is. Stop for a second and think about the exposure. Yeah? If you can remove that piece of equipment. You can then go through a wash if you're at a patient's house, hand washing, soap and water. If that's not available and you're in the back of the vehicle, you can look at using the alcohol gel and basically the Clinels in order to clean up. Okay, when you're using Clinel, I'd like you to consider, if you have to use it against your face or something like that, move away from the membranes. Eyes closed, don't inhale, and then wipe away from the area that may be contaminated. Yeah? Try and protect the membranes. Every one of these procedures is a step-down procedure. You can remove some of the risk on each stage by doing it correctly. You need to do this on a regular basis. I'd like to ask you a question. If we were 6 months down the line, 6 months ago from now, what would you have done with a norovirus patient? What would you have done with a patient with flu? Yeah? It's the same procedures, it's universal precautions. All we're doing is the same process, but for COVID-19. A final point to mention, CPR. We've had a number of things being mentioned in terms of laying blankets across the face of a patient, laying plastic bags across the face of a patient. What I'd like you to consider is the dignity of that patient. At the end of the day, they're still our patient. Yeah? You have masks. You can actually place a surgical mask or an FFP2 on the patient and thereby reduce it. Also, think about anybody else that might be in the house that may also be presenting. Yeah? Ask them to wear a mask while you're there and basically put those on. That's it. I'd like you all to stay safe and good luck.